You may be seated. The Secretary will now read the second order of the day.
Debate on Vote 6, Health, Western Cape Adjustments Appropriation Bill.
Thank you. I see the Honourable, the Minister of Health, Minister Mbombo.
Thank you. Honourable Premier, in absentia, the Madam Speaker, members of the House, anyone from the gallery, I just want to say good morning. Today, I present to this House the adjustment budget of the Department of Health for this financial year. But Madam Speaker, allow me first, before I do the presentation, I just want to apologize on behalf of the department that they are unable to be here because of urgent matters. And then secondly,
Minister Mbombo, kindly just take your seat, please, quickly, if you don't mind. I just need to, there's too much noise, too much private conversations, so if we could just afford the Minister the respect. Minister Fritz and Minister Schaefer. Fritz and Schaefer, Honourable Fritz and Schaefer, thank you. Minister Mbombo, you may proceed.
Thank you. Also, first of all, before I present the adjustment budget, I want to acknowledge that tomorrow is World AIDS Day. Let us all remember those who are living with HIV/AIDS, and also those who died from HIV/AIDS, and those who are infected, and all those who are affected. Secondly, I just also want to acknowledge that you are part of the United Nations 16 Days of Activism, where the focus is on workplace violence in the workplace inclusive of the home. Let's all remember for those who are suffering under the hands of the perpetrators. Also for those who died from gender-based violence and those who are still living with that. And then thirdly, Madam Speaker, also allow me, before I go to Vote 6, during the period that we were appropriating, it was the Treasury member, Mayor, some of the responses included health, from what we said from the opposition. I just want to send condolences to Member Makakla when he indicated that he lost a family member. And I just want to state that we did write to Member Makakla to get more information. For us, we don't dismiss the people's truth. We have to journey in terms of what the people have felt, but we need also for the people to get the closure. Hence, we are open up for getting more information. And then the other that was mentioned during the appropriation, it might not necessarily be applicable now, but it was also mentioned. It was the issue of the Kailicha. I just want to acknowledge the letter we received from the members, the ANC caucus, want to visit the hospital, and we have acknowledged that it's part of the oversight. They are welcome. We have agreed to that. And then lastly, the other that was mentioned, it was the Cuban doctors, which is I'll respond during the conclusion. Thank you, Madam Speaker, for allowing me for such. Now, going to the adjustment budget. There's been an increase of 36 million from the main appropriation, which is meant for service pressure. As probably people always hear me saying that for us, we render services 365 days, 24 hours throughout, servicing from the unborn to the oldest person, also inclusive of the dead. We have a population that has increased. Not only the increase of the population, but our disease profile is completely different from across the country because we have got a high rate of the injury and personal violence because of gangsterism. Hence, for us, it's not only about the numbers, but also the kind of disease that we see. And then secondly, the rollovers. We have rollovers of 106.6 million. Program 2, there's a 30.2 million that has been rolled over because of the Global Fund. We are the only province that received a fund in this period for young women and girls. But as is always the case with the international funders, they'll never give you on time as according to our budget here. We receive it late, hence we'll find that it's always going to be the rollover. 1.3 million that is being rolled over for the WOW, Western Cape on Wellness Initiative, where we are promoting health activities and non-communicable disease. Program 3, 18.6 million that is being rolled over for the computer-aided electronic system for the EMS, as I was presented previously here in this house, in terms of what is it that we do, where we try to avoid issues related to the assault of our staff members using the electronic system as well. Program 6, 3.3 million, that is being rolled over because of the bursaries from nursing students. When the students fail, we have to hold the money, although the money is still committed, but you cannot give the student who has failed. You have to wait until that student passes. Hence, we'll find that there's a rollover. Program 8, 14.6, it's a part of the equitable share related to the infrastructure, the delays related to the procurement and lengthy implementation period. For example, now I've been to one of the clinics, for example, in the Witzenberg, where there's been delays in terms of the infrastructure. Now, other adjustments, which equate to 70.3 million, includes a shift to Vote 1, Department of the Premier, related to the co-funded Provincial Employee AIDS Program, where all departments put together the money, and then for us to render the services for the staff related to HIV/AIDS, for all staff in the Western Cape government. 1 million shifted from Vote 5 to education, also related to the AIDS program. 500,000 to Vote 12, economic development and tourism, related to expansion of the WOSA, which is the whole of society approach, which is we're doing together with them and other departments in Saldanha. It's also inclusive of the pilot for the universal health coverage. 2.2, that has been shifted to Vote 1, again, Department of the Premier for the ICT requirements for all the health facilities. I think she has already mentioned in terms of the broadband and so forth. 54, that is related to the delay, as I mentioned, Global Fund, now that is being also rolled over. And then lastly, the employees' compensation that is surrendered to the Provincial Treasury in order to take consideration of issues related to the compensation of the employee. I present the budget. Thank you.
Thank you, Minister. I now see the Honourable Member Botha.
Thank you, Speaker. Madam Speaker, the DA-led Western Cape government, under the leadership of Minister Mbombo, is committed to creating access to person-centered quality care. It has undertook to provide equitable access to quality services in partnership with the relevant stakeholders within a balanced and well-managed health system for the people of the Western Cape and beyond. Speaker, the Western Cape Department of Health continues to cater for the people of this province through district health services, emergency medical services, provincial hospital services, central hospital services, health sciences and training, healthcare support services, and health facilities management. In the midst of an increasing demand for health services, the department has further consolidated its objective of reducing service pressures by building the new district community day centre in Cape Town, the Hillside Clinic in Beaufort West, the bulk store at Karl Bremer Hospital, the emergency care at Stellenbosch Hospital, and the computer tomography, CT scan and ward completion project at Kailicha Hospital. It further replaced the Napier Clinic and Prince Alfred Hamlet Clinic while upgrading the emergency centre at Tygerberg Hospital. Speaker, I want to bring heroism to all medical staff, especially to our province's nurses, who will be on the receiving end of people suffering from injuries due to carnage on our roads and other injuries that will happen as a consequence of the upcoming silly season, drunkenness over the upcoming holiday period. Speaker, while many of us will celebrate the holiday season with our loved ones and families, a special thanks must go to the EMS personnel who have had a tough year as it is and who will most likely be the first point of receiving with regards to addressing festive season casualties. And I again call upon our communities to be on the lookout for these EMS personnel in keeping them safe while they are executing their duties. Speaker, the demand for healthcare services continue to grow as disease places enormous strain on the health system. This reality, coupled with natural disasters and preparations for additional budget reductions, made the past financial year a particularly challenging year for this department. Despite this, there were no unauthorized expenditures recorded and no fruitless and wasteful expenditure. In light of the above, Speaker, it is most welcoming that the Department of Health's adjusted appropriation for the 2018-2019 financial year is 23,099,979,000 rand, an increase of 36 million rand from the main appropriation to assist with addressing the increasing demand for quality healthcare that our government provides. Speaker, the Minister has given the breakdown within programs where this money will be used, and I'm not going to go in that program by program. A special mention must go out to all those respective award winners at the Western Cape Government's Health Cecilia Makawani Awards evening that took place on Friday the 9th of November at Kirstenbosch. The awards honor, celebrate and value nurses for their selfless dedication to the nursing profession and exceptional work done in their field through making a lasting difference to their patients' lives and contributing to the improvement of their community's well-being. Speaker, I'd like to thank all my colleagues on the Standing Committee. Thank you for your support throughout our sessions and when we did our oversight. Thank you to our coordinator, Namonde Jamka, Assistant Coordinator, Mary Ann Burgess. Speaker, I would like to thank Minister Mbombo, the Head of Department, Dr. Beth Engelbrecht, and all the personnel that steer this department, but most specifically the nurses for their continued hard work, dedication, and commitment to making healthcare accessible to all residents of the Western Cape. With all this said, Speaker, I hereby support this appropriation. I thank you.
Thank you. I now see the Honourable Member Gillian.
Another beautiful in blue. I'll never join the blue train.
Order, please.
Speaker, allow me to greet the department in absentia and the community at large listening today as we are at the end of a very difficult year and as we prepare for the festive season and all its challenges faced by this department in the province. Speaker, in the last round of the EFF Steenhuisen fiasco, John Steenhuisen told Parliament that if that is what a university education gets you, you can keep it. And if you think that is...
Order, please.
And if you think that it is higher logic, then I'm afraid you deluded. Unfortunately, in this house, we've fallen victim of that delusion. We thought by getting a professor to run the health department, things would turn for the better. Instead, Speaker, our hospitals in the Western Cape have turned into places where people go to die. I am afraid that through this budget,
Order, please.
our public hospitals will move from being death centers to mortuaries. I say this because of the various programs decreased appropriations. Programs 1, 2, 6 and Program 8 have all been affected by the cuts in adjusted appropriations. The reality is that whereas the adjustment appropriation for this department increased by 36.2%, it is not enough to change the terrible state of our public healthcare systems in this province. The decreased appropriation will make things worse. the adjusted appropriation for Program 1 is reduced by 34.8 million, which is shifted to other programs. 21 million is shifted away from Program 6. For Program 2, the adjusted appropriation is reduced by 2.5 million, with a rollover of 31.6 million. The adjusted appropriation for Program 2 still decreased. This is unacceptable, for the MEC and her department cannot gamble with people's lives like these. The decrease and the adjusted appropriations for these programs are just unacceptable. In explaining what the impact of the decrease will be, let me use the Kailitsa District Hospital as the case study. The state-of-the-art hospital in Cape Town's biggest and fastest growing township is a brainchild of the ANC. It was opened 6 years ago to relieve service pressure at GF Worcester Hospital, which serves Cape Flats communities. With the closure of Worcester, the challenges at this hospital worsened. The hospital is now overcrowded with staff shortages.
Order, please.
Worse care and worsening mortality rates. Patients die in this hospital while waiting for beds and chairs and on the floor. And they go for days without receiving care. Staff members are exhausted and burned out due to heavy workload. Staff simply cannot cope with the workload. Part of the reason for this is the many frozen posts at this hospital. Speaker, the MEC, her department and the hospital board...
Kindly take your seat. The debate between Honourable Nkondlo and I suspect it's Minister Windy, the Chief Whips also picked that up. It's unacceptable, people. We need to respect a speaker on the floor. Thank you. You may proceed, Honourable Gillian.
Thank you, Speaker. The MEC, a department and the hospital board are aware that parts of this building are not compliant with fire and safety standards. Some emergency evacuation routes are ineffective, yet nothing is done to address the challenge. There is corruption and in HR processes like nepotism, hiring unqualified staff, and manipulation of performance reports in this hospital. There is a high turnover at the hospital due to resignations and firing of staff that seem to question these irregularities. Ek as Afrikaans spreek in my tong hakke bietjie speaker. Most times without following any disciplinary processes. I wrote my own speech, I do my own research.
Order, please.
This is the case in almost all the other hospitals in the province. Through this process, the MEC was presented with an opportunity to address these challenges, and as always, she failed to rise to the occasion. I want to ask the MEC if she thinks this budget will assist to address the challenges in our public healthcare systems. Will it assist to achieve the situational analysis
Honourable Gillian, sorry, I'm really sorry to interrupt you, but your own members are drowning you out now. I see the Chief Whip's trying to get their attention. You may proceed.
Situational analysis indications like average length of hospital stay and inpatient bed utilization ratio at district hospitals. In the Western Cape, Speaker, there is a shortage of doctors, nurses, EMS personnel, forensic pathologists, pharmacists, and other critical posts. The decision to curtail adjusted appropriation for compensation of employees by 42.6 million, as well as an additional 14 million that has been surrendered to the Provincial Revenue Fund is ill-conceived. The Western Cape cannot afford to make such unwise decisions. The decisions come at a point when national government has committed 350 million to employ more healthcare workers. Speaker, this department is known for its high under-expenditure and fruitless expenditure, as we were told by the AG last year. Over 190 million was not spent. On top of that, there were rollovers which amounted to over 106 million rand. That is over 290 million rand that could have employed more staff and procured the much needed machinery and equipment. It is a concern for me that in the first 6 months, only 45% of its budget was not spent with programs like the health facility management, spending only 30%. 53 million was not spent last year and rolled over to this year. The department moved over 8 million away from community health facilities, and the adjusted appropriation for emergency medical rescue services is decreased by over 7 million rand, while all of us know the challenges we face in that department. This can only mean that the much needed infrastructure developments needed in our hospitals will not be finished on time. Lest we forget that the same thing happened before Jooste was closed down. Budgets for its maintenance were not used. Who knows? Maybe Tygerberg is next in line of this planning. The MEC must also tell us, where is the budget for the hospital to replace GF Jooste, which he promised the people in 2015 already? With all the challenges at our psychiatric hospitals, the adjustment appropriation for the psychiatric mental hospitals is reduced. What nonsense is this? Speaker, the same problems in Kailicha district hospitals, which I explained above, are also persistent in the centers. Everybody knows about the challenges at Valkenburg and Lentegeur hospitals. Yet the MEC decreases the budget for this hospital. Speaker, the MEC is aware, because I wrote a letter to the MEC and the department, of the challenges at Ceres Hospital, where there are 12 patients being treated for drug-related illnesses, placing at risk the lives of other patients. They should be treated at psychiatric hospitals, not at district hospitals, but still the budget for those patients and centers are removed, not only in Ceres, but throughout the province. Speaker, the professor has decreased the funds for health sciences and training by over 24 million rand. The 27 million for training nurses has been taken away. At first, it was blocking an opportunity for poor students from disadvantaged backgrounds to go for free medical training in Kiba, and now it is taking the budget for training nurses away.
Honourable Gillian, if you could finish up, your time has expired.
Okay.
Just finish your sentence. Thank you.
I'm going to finish now. I'm just going to talk about AIDS Day. In closing, tomorrow is the World AIDS Day, in which the world unites in the fight against HIV/AIDS and to show support. Lastly, let me wish all health professionals and workers well over the festive season. Thank you for being in service of all the people of the Western Cape during this festive season. I thank you.
Thank you, Honourable Gillian.
And I reject the budget.
In the absence of the EFF and the ACDP, I see the Honourable, the Minister, Mbombo.
Thank you. Again, just want to thank the department in absentia and also the coalface, not only the senior managements that are there. I want to thank the standing committee, starting from the chairpersons, and also some of the other people who have also chaired, assisted you in the chairing. The whole of the committee, inclusive of the member Gillian. I think, yes, of course. I mean, the committee does play their role, very crucial, and in terms of challenging us. We get the blows, and then we return the blows, blow by blow. Thank you for that. Now, responding to what has been said now, the first part of, probably, must I say, is that the below the belt, probably let me also probably, if it's below the belt, maybe probably let me just pretend like I'm a professor and maybe quote, be like a tree, even if people throw a stone to harm you, drop a fruit in order to benefit them. Now, going forward, what we are supposed to do. Again, the issue of quoting statistics out of the blue, it becomes problematic. I understand Member Gillian is trying to play politics, but unfortunately, some of us are taking this responsibility very serious. I think probably, let me also again, because I thought I was not going to talk about Khayelitsha because the members, they've asked to visit and we are waiting for their report so that we can engage. But probably again, let me pretend like I'm a professor and say that Khayelitsha, you'll always be judged differently from other level 1 hospitals because it caters mostly the people of Khayelitsha. In that community, you know each other. When someone has gone to the hospital and didn't return, it's true when someone says that the hospitals at the end is when the people are sick and then they'll end up dying. There'll always be death in the hospital. There will always be death in the hospital. But the question is about what is the average? Is it still within the substructure norms? Because Khayelitsha and the Eastern is the same substructure. Is it still within the level 1 hospitals? Is it still within the levels of the provincial? And how do you compare with other level 1 hospitals in the same context, nationally and internationally? And I still say, Khayelitsha actually is doing fairly better than other level 1, even in the province. But the reason now people find that it becomes so emotive to say, I know someone died, because it caters for the people. We know each other in that Khayelitsha. Compared, Victoria is a level 1. Victoria takes patients from the Wynberg, takes patients from the Retreat, take patients from the Lavender Hill. So someone who died who's from Retreat, they won't be known by someone from Lavender Hill. Same applies with the False Bay. It takes people from the Maspumelele, the Ocean View, and so forth. So if someone is from Ocean View, might not know how many people who have died from, and so forth and so forth. Same applies with the Kalbrima, takes it from the Durbanville and so forth. So the reason for Khayelitsha that is everyone is put it like on the spot as if it's a people dies because it caters for the same vicinity. You will know Zamile went to the hospital, didn't come back. You will know that Ubanban comes to it, so that's the point. But the issue is about, in terms of the statistics, it's doing fairly well. And also the substructure on its own, it has got more of health facilities than any other substructure. But as we have indicated, that the issue is about the population is increasing, the disease profile, because where you get a lot of mix, compared, for example, with the southern, where you might have cardiovascular diseases and others, you don't have communicable disease. In the Khayelitsha, you'll have the communicables, they are here. We have the violence, interpersonal violence, they are all here. So you get the whole fruit of salad under one hospital. And the number of beds, it started as 300 beds. We have increased now up to 50. We're going to have a psychiatry unit. It's going to go more and more up to 40. And the disciplines that are there, you don't get them in level 1, you get them at level 2. So that's where we are in terms of the Khayelitsha. Now, health systems. The health systems, again, I'm still putting that cap that I'm pretending I'm a professor. Health systems, you cannot divorce economy from health. People when people are ill, it means that they end up not going to work. It means that it also impact even on their own status in terms of work production. So if now we have got an economy that is at this level, yet you'll find that the prices of medicine is going up, it means that that half% of the budget you get, we have to rob Paul and pay Pauline. So just when we get this money, equitable share, it's not in proportion to the population, also not only the numbers, but also the disease profile. So one person who goes to the Eastern Cape at a Zingolweni clinic will come there with a cough and so forth. So there's an increase in the number. But here, it's not only about the cough, but because of the interpersonal violence, the gang and also those, then it means that that person needs more advanced intervention than the other. So the issue of the economy, the issue of poverty, the issue of unemployment, the issue of inequality, they impact on health. Like now we're speaking about safe travel and so forth. The road accident that's going to happen is going to be my problem. Just like the gender-based violence become my problem, HIV/AIDS become my problem, and so forth and so forth. Now, going to under expenditure. Going to the under expenditure, the 310 million, I think it was also indicated when I heard that the members were posting about 300 million that were committed by the national and more staff members and so forth. The money, it's a money that was underspent from NHI. So that's why the civil society and everyone is up in arms against fighting the national minister, because they were given the money for NHI, they played games, now they've got, so it's not a new money. Now that money, it's not a new money, it's a money from the NDOH, which now
please.
The president, because we had a presidential part of where health and education participated. So that money now, it's about where now, what must we do with the money? It's about now the commitment, it's about let's do the HR. And B, that money is only for the 3 months, because it's supposed to be through the MTEF. Instead of being committed for the 3 years, which is year 1, 2, 3, it's 3 months left now for 18-19, another 3 months, so there's still a shortage. So you mustn't think that there's no new money. Health system is underfunded. Of course, there are issues of the corruption and mismanagement and so forth that is happening everywhere, where now it has an impact. About the under expenditure, fruitless, whatever, we are the only department for the past 14 years that has unqualified audit. We are the only department for past 3 years where we have clean finance. Only department in the country that has got clean finance. There's no other. There's no other.
Order, please, members. If you wish to pose a question, do it through the chair. You may proceed, Minister.
Okay. And then lastly, again, the issue about Josta and whatever, I think I've answered that many times. Because my understanding, members, they understand that it's completely different when Auntie Sarah is asking me questions about when it's going to be Josta, where now I have to explain in terms of from the community perspective. Now we are the legislators here. We have gotten access to information. What are the phases of the delivery system for infrastructure? The last time we spoke here, we provided the information that where we are, out of the 8 phases, where we are. So everyone knows that as hospital that has been planned for now, you won't see the construction, the building,
Minister?
until, for example, previously...
Minister, kindly take your seat, please. Sorry, there's a point of order. Honourable Lecker.
Thank you, Speaker. Speaker, I would like... Speaker, I would like you to caution or make a ruling, because as I'm sitting here, I can relate that a member, what's I said? Mbombo, is casting aspersions on members on this side. So I think that on its own is against the rules of this House. I Tula Makul.
Sorry, Member Lecker, I will have to check the record. I'm not quite certain what it is, but we will have to revert to Hansard and come back to the House. Sorry. Order, please, members. You may proceed, Minister.
Okay, I'm responding to each and every one that was mentioned, so I'm not sure exactly what was their casting aspersions. So the issue, I think it was the last point about the just the way it was, because at the time we indicated that the previous site was too small for the level 2, because now I wanted to increase from the level 1 to the level 2, because the previous hospital didn't even have maternity, didn't have pediatrics, and so forth. So it needed the whole package, because as we're already saying that the whole population has increased, the disease profile has changed. So we wanted also for it must be a training for where the medical students, the nursing and whatever, it forms part of it. So that's what we said. Hence the issue, firstly, it was about the issue of the site, which at the time we couldn't be able to not only to identify, but when we identify it, it was about, we cannot preempt in terms of talking about the school before the whole process is according to the School Act has been. So the whole issue, it has been like that. So you will see the JOSTA is going to rise, whether not in our term now, it might be the other term. Thank you very much.
Thank you. That concludes the debate on this vote. The House will be suspended for the officials for the next vote to take their seats. The House is suspended.